What's good, YouTube? It's Jay, and I'm back again tonight with another video. If you are a respiratory therapy student or respiratory therapy graduate or a nurse or someone who wants to learn more about respiratory therapy, well, you're in the right place. I'd like to welcome you to Respiratory Therapy Essentials for the TMC exam. As you can see tonight, we will be talking about neuromuscular diseases. And without any further ado, let's do this. For the TMC exam, you will have to know a few things about neuromuscular diseases and disorders. One of the main disorders I have listed on my board. And again, we'll work from the left side of the board to the right side of the board. Number one is this is an autoimmune disorder of the peripheral nervous system. It causes destruction of the patient's peripheral nervous system as well as inflammation. Now, unlike myasthenia gravis, this disease moves from the ground to the brain. And remember that because you will see that again for the TMC exam. It moves from the ground to the brain or from the legs to the head. When you assess these patients, look for an acute febrile illness. However, most of these cases will be viral in nature. So if the patient is complaining of leg pain or cannot walk, but they don't present with any type of fever, don't let that bother you. Continue to assess the patient. They will have acute weakness in their legs and they will be cyanotic. Here's the difficulty of this disease. If the disease progresses to the head, the patient will have respiratory problem that can cause death. And you have to be ready to intubate these people. Now, we must assess ventilatory parameters for these patients. Mainly the tidal volume, the vital capacity, the MIP, maximum inspiratory pressure. If they are decreasing, that would be the key to placing these people on the ventilator. Okay, do not let them totally fail. If you see the ventilatory parameter decreasing, go ahead on and intubate. Don't play around with these people. They will die on you. Enrollment number 2, when the ventilatory parameters are decreasing, you must act. And I put that there because the NBRC recommend a tidal volume of 6 to 8 milligrams a kilogram predicted body weight. Your vital capacity should be less than 10 milliliters a kilogram, and your MIP, maximum inspiratory pressure, should be less than 20 centimeters or no less than 20 centimeters water pressure. If it goes down to 19 and 18 and 15, that's not good. You will definitely have to intubate this patient. Now, remember that neuromuscular diseases are also restrictive disease, and you will see reduced volume, forced vital capacity, as well as the tidal volume. Now, there are other things that we must monitor when we are caring for the neuromuscular patient, especially the patient with Guillain Barre, specifically your patient with Guillain Barre. We do what is called a lumbar puncture. And when we do lumbar puncture, we are actually looking for protein in the cerebral spinal fluid. The protein count is greater than 500 milligrams a deciliter, then your patient has Guillain Barre. If the EMG is abnormal, or if they have an increase in IgM, the patient has a diagnosis of Guillain Barre syndrome. Now, I don't know how many of you are familiar with this disease, but it is ugly, it is debilitating, and it can kill, all right? You will see this on the TMC exam. you will see the information on this board on the TMC exam. Now, when it comes to treatment and management, of Guillain-Barre syndrome, if you hear nothing else that I say, I want you to hear this. These patients need a lot of supportive care from their families, physicians, doctors, and nurses. They need supportive care. The main objective is to stabilize their respiratory system, because in these diseases, it attacks their respiratory system where they can't breathe. These patients must be admitted to the ICU. You can't treat these people on the medical floor. They will present to the emergency room and with leg pain, or can't walk for several hours or a day. They're cyanotic. Once the primary assessment has been done, and once you decided that this person has Guillain-Barre, send them directly to the ICU for their treatment. That's a must. You must treat these people in the ICU, and yes, you will see that on the exam. Closely monitor the tidal volume. Closely monitor the tidal volume, vital capacity, MIP. Vital capacity, tidal volume, MIP. Will you see these parameters on the test? Absolutely, and in that order. Oxygen therapy, we must make sure that they have oxygen. Treat them accordingly when it comes to oxygen. We don't want to give them too much, but make sure that we give them oxygen. Hyperinflation therapy, and maybe in these type of people or these type of patients on the ventilator, you might want to consider IPPB. Pulmonary hygiene is very important to them. We need to make sure that we make sure their mouth are clean, they're around their lips are clean. It's very important to make sure that our pulmonary toilet for these patients is intact. Now, there are some other things that are very helpful when it comes to Guillain-Barre syndrome, which is plasmapheresis. We can give immunoglobulin therapies, and all of these greatly help the patient with neuromuscular disease, especially Guillain-Barre. Plasmapheresis and immunoglobulin therapies are greatly helpful in these patients. And there you have it, people, Guillain-Barre. Now, this is an autoimmune disease. It moves from the ground to the brain. Mostly it is viral. These people will present with leg pain and cyanosis. And also you must monitor their ventilatory parameter very closely, because they will fail. Tidal volume, vital capacity, the MIP.